Good day. Today we will be conducting an assessment called Parenteral Administration. So this includes the intradermal, intramuscular, and the subcutaneous. So firstly, we're going to conduct the intradermal route. So we need to do the general preparation. We need to check the doctor's order and check the medication administration record or the MAR. So we need to consider this since the chart of the patient is more reliable than the medication ticket. Next, we need to check the label on the medication carefully against the MAR to make sure that the correct medication is being prepared. So this is important because for us to prevent error of any medication administration. Okay, so next is we need to follow the 3 checks for administering medication. So we need to read the label on the medication when it is taken from the medication cart, before withdrawing the medication, and after withdrawing the medication. So this is to ensure we are giving the right medication and right dosage to the patient. And make sure to check the expiration date before injecting or before using the medication. Now is we need to organize the equipment to save time and energy. Now, we will be preparing the medications from the vials. So first, we need to perform hand hygiene and observe other appropriate infection prevention procedures. That is to prevent the deterrence of the spread of bacteria. I'll be right back. Okay, so now we need to prepare for the medication vial drug withdrawal. So we need to mix a solution if necessary by rotating the vial between the palms of the hands. Remember, not to shake. So just like this. Okay, afterwards, we need to remove the protective cap or clean the rubber cap of a previously opened vial for an antiseptic wipe by rubbing in a circular motion. So this is the antiseptic swab in a circular motion, and then we need to throw this to the receptacle bin. Next is we need to withdraw the medication. Attach a filter needle as agency practice dictates to draw a premixed liquid medication from multi-dose vials. We need to ensure that the needle is firmly attached to the syringe, and then we need to remove the cap from the needle, then draw up into the syringe the amount of air equal to the volume of the medication to be withdrawn, so we can easily get the right amount of medication. So first we need to inject air equal to the amount of medication we will be giving. Next, we need to carefully insert the needle to an upright vial through the center of the rubber cap, maintaining the sterility of the needle to avoid any contamination. Just like this. Next, we need to inject the air into the vial, keeping the bevel of the needle above the surface of the medication for multi-dose vials. Like that. And then, we need to withdraw the prescribed amount of medication using either of the following medication. Hold the vial down with the base of the lower than the top. Move the needle tip so that if it is below the fluid level, and withdraw the medication. So just like this. So now we need to invert the vial, ensure the needle tip is below the fluid level, and gradually withdraw the medication vial. So we will be withdrawing 50 units. So just like this, upside down, and then we will be withdrawing the medication. Okay. And then we need to put the cap on so that it won't cause any harm or injury, and put it in a safe place. Now let's move on to intradermal administration. Explain to the client that the medication will produce a small wheal, sometimes called a bleb. A wheal is a small raised area like a blister, so the client will feel a slight break as the needle enters the skin. So, good day ma'am. My name is Zia Michael J. Velasquez, your nurse for today. So we will be doing a skin test. So you will feel a slight pressure, but don't worry, I'll do my best so that you won't feel discomfort. Next is we need to provide the client privacy to protect the client's integrity and provide comfort. So we need to close the doors and curtains. So, need to select and cleanse the site. So, I'm going to select the forearm, about a hand's width above the wrist, and 3 or 4 fingers widths below the antecubital space. So, this is an area free of tenderness, hardness, swelling or itching, or localized inflammation. Also, avoid using sites that are tender, inflamed, or swollen, and those that have lesions to prevent contaminating with the medication. So, apply glove as indicated by agency policy to maintain sterility. This is our hand now, zero. Okay, so now we need to cleanse the site using a firm circulation motion starting at the center and widening the circle outward. Allow the area to dry thoroughly. Drying the skin prevents inactive of meds being given. And we need to throw this at the receptacle bin. So next is you need to cleanse the site using a firm circular motion starting at the center and widening the circle outward. Allow the area to dry thoroughly. Drying the skin prevents inactive of meds being given. Using the antiseptic swab and outward. Circular motion and throw this at the receptacle bin. Now, we need to remove the cap, the needle cap, while waiting for the antiseptic to dry. So this is where we're going to use. Expel any air bubbles from the syringe. Small bubbles that adhere to the plunger are no consequence. Also remember that the small amount of air will not harm the patient. So first we need to flick it and dispose of any air bubbles. Okay, so now we need to grasp the syringe in the dominant hand. So my right arm is my dominant hand, close to the hub, holding it between the thumb and the forefinger. Hold the needle almost parallel to the skin surface with the bevel of the needle up, just like this. So next is we need to inject the fluid. So with the non-dominant hand, pull the skin at the site until it is taut, because taut skin allows for easier entry of needle and less discomfort to the patient. So just like this, again, and then we need to insert the tip of the needle far enough to place the bevel through the epidermis into the dermis. So now we need to stabilize the syringe and needle. Inject the medication carefully and slowly so that it produces a small wheel of the skin. If a small wheel appears, then the solution is in the intradermal tissue. Okay. Okay. So injecting. So there is a wheel injecting. So now we need to withdraw the medication quickly at the same angle at which it was inserted. So we need to activate the needle safety device, apply a bandage if indicated. Okay. And close this. Throw this at the receptacle bin. So do not massage the area and apply a bandage if indicated to minimize tissue damage and discomfort. Remove and discard gloves and perform hand hygiene to deter the spread of microorganisms and prevent contamination. So after we remove the gloves, we need to perform hand hygiene again to deter the spread of microorganisms and prevent contamination. I'll be right back. Okay, so now we need to circle the injection site with ink to observe for redness or in duration or hardening per agency policy. So now, we need to document all relevant information and records of testing material given the time, dosage, route, site, and the nursing assessment. Okay, so now we need to evaluate the condition of the site for 30 minutes depending on the test. Measure the area of redness and in duration in millimeters at the largest diameter and document the findings. Okay. So So now, we need to document if the client had a positive or negative skin test result following agency protocol on labeling of allergies. Positive result is greater than or equal to 15 millimeters and negative result is below 15 millimeters. So now let's move on to the intramuscular. So for the general preparation, we need to check the doctor's order and check the medication administration record or MAR. So we need to consider this since the chart of the patient is more reliable than the medication ticket. Okay, so now we need to check the label of the medication carefully against the MAR to make sure that the correct medication is being prepared. So this is important because for us to prevent any error of medication administration. So this is for the intradermal. So we will be using an ampule. Okay, also check for the expiration date. Don't forget. Okay, so follow the 3 checks for administrating medications. First is we need to read the level of medication. So when it is taken from the medication card. Second, before withdrawing the medication. And third, after withdrawing the medication to ensure that we are giving the right medication and right dosage to the patient. Next is we need to organize the equipment to save time and energy. Now we will be preparing the medication from the ampules. We need to perform hand hygiene and observe other appropriate infection prevention procedures. So I'll be right back. So now we need to prepare the medication ampule for drug withdrawal. So we need to flick the upper stem of the ampule several times with a fingernail, causing the air bubbles to rise. Next is we need to use an ampule opener or place a piece of sterile gauze or alcohol swab between your thumb and the ampule neck or around the ampule neck and break off the top by bending it towards you to ensure the ampule is broken away from yourself and away from others to conduct safely. Now, we need to place an antiseptic wet packet over the top of the ampule before breaking it off just like this. Afterwards, dispose of the top ampule in the sharps container to reduce the risk of cuts or potential exposure of accidental injury of glass shard. Like this. Now we need to withdraw the medication. Place the ampule on a flat surface, attach the filter needle to the straw of the syringe. Okay. Now we need to remove the cap from the filter needle and insert the needle into the center of the ampule. Do not touch the rim of the ampule with a needle, tip, or sharp to prevent accident. Next, with a single dose ampule, hold the ampule slightly to the side if necessary to obtain more than the ordered amount of medication to obtain all the medication while keeping the needle sterile. Just like this. So now is we need to get this in with the cap. Again, stand and get the medication needed. Okay. So now we can dispose the filter needle by placing in the sharps container to prevent accidental injury. If giving an injection replaces the filter needle with a regular needle, tighten the cap at the hub of the needle and push the solution into the needle to the prescribed amount to prevent glass shards from containing the medication. Okay, so again, we need to close the needle to prevent any harm or injury and place it at the safe place. Now let's move on to the intramuscular injection. Perform hand hygiene and observe other appropriate infection prevention procedure to deter the spread of bacteria. So I'll be right back. So now prepare for the medication from the ampule or vial for drug withdrawal. So organization and planning result in economy of time and effort and minimize confusion. Now we need to provide the client privacy to provide comfort. So again, close the doors and curtains. So now we need to prepare the client prior to performing performing the procedure, introduce self and verify the client's identity using agency protocol to enhance support and ensure if care is being rendered to the correct patient. Good day, ma'am. My name is Azia Michael J. Velasquez, your nurse for today. May I see your wristband, please? Okay, so please state your name and age, your birthday. Okay, thank you so much. So, assist the client to a supine, lateral, prone, or sitting position depending on the chosen side. If the target muscle is the gluteus medius, ventrogluteal side, have the client in the supine position just like this, or flex the knees in the lateral position, flex the upper leg in the prone position, toe in. Positioning the patient in a comfortable position increases efficiency in performing the procedure. Now we need to obtain assistance in holding an uncooperative client. So since my patient is cooperative, we won't be needing further assistance. Now we need to explain the purpose of the medication, how it will help, using language that the client can understand, and include relevant information about the effects of the medication to gain the patient's cooperation. So ma'am, mag-inject ko sa imo ha dili amang o. So maka-feel ka ng mga paak ra sa mo ha dito mo pala ka ha. Nga try it tanawon sa nako ma'am, try jud nako umbes para di siya masakit ha. So ang sa effects ma'am, so ipong ka ma'am, or kanang basig na suka ka, pero if naaman ma'am, tawagol ako nimo or para mantagan ikaw sa imong mga kinahanglan. Okay, now need to select, locate, and cleanse the site. Select a site free of skin lesions, tenderness, swelling, hardness, or localized inflammation, and one that has not been used frequently. If injections are to be frequent, alternate sites. Avoid using the same site twice in a row. Locate the exact site for the injection to reduce discomfort. Infection or precautionary. So now we need to apply clean gloves to maintain sterility. Clean the site with an antiseptic swab using a circular motion. Start at the center and move outward. Friction aids in cleaning the skin and removes dirt out in a way direction. Okay. Close the receptacle bin. Transfer and hold the swab between the third and fourth fingers of your non-dominant hand in readiness for needle withdrawal, or position the swab at the client's skin above the intended site. To prevent needle break injury, and seeing the needle through the skin serves as guide to the depth of the insertion. Okay. So placing this at the second and third, just like this, in my dominant hand. Now we need to prepare the syringe for injection. Remove the needle cover and discard without contaminating the needle to prevent contamination. Okay, just like this. Okay, if using a pre-filled unit dose medication, take caution to avoid dripping injection. So, if this does occur, wipe the medication off the needle with a sterile gauze. Inject the medication using the Z-trap technique. Now, need to use the ulnar side of the non-dominant hand to pull the skin approximately 2.5 centimeters to 1 inches. So, to the side, under some circumstances such as for an emaciated client or an infant, the muscle may be pinched. Now, need to hold the syringe between the thumb and forefinger as if holding a pen, just like this. So, pierce the skin quickly and smoothly at a 90-degree angle. So, just like this. You need to hold the barrel of the syringe already with your non-dominant hand and aspirate by pulling back at the plunger with your dominant hand. So, aspirate for 5 to 10 seconds. So, if blood appears in the syringe, withdraw the needle and discard the syringe and prepare for a new injection. If blood does not appear, inject the medication steadily and slowly, approximately 10 seconds or millimeters, which holding the syringe steady if using the ventrogluteal side. Okay, so, excuse me, this trap technique. Now, after injection, wait for 10 seconds if using the ventrogluteal side to ensure that the needle tip is located at the desired site and has not accidentally punctured the blood vessel. So, injecting. So now, to withdraw the needle smoothly at the same angle of insertion, so just like this. Afterwards, apply gentle pressure at the site with a dry sponge, so like this. Now, if it is not necessarily to massage the area at the site of injection, it minimizes patient discomfort. So if bleeding occurs, apply pressure with a dry sterile gauze until it stops. Okay, so now we need to activate the needle safety device or discard the uncapped needle and attach the syringe into the proper receptacle to prevent an injury. So before that, we need this. So, and then discard this. So now we need to remove and discard gloves and perform hand hygiene to deter the spread of bacteria and prevent contamination. So I'll be right back. Okay, so now we need to document all relevant information, the time of administration, drug, name, dose, drug, and the client's reaction to prevent medication error and for the database for the future. Okay, so now we need to assess the effectiveness of the medication at the time it is expected to act. Now let's prepare for the medication of the subcutaneous route. So let's move on to the general preparation. Again, check the doctor's order and check the medication administration record, the MAR. So we need to consider this since the chart of the patient is more reliable than the medication ticket. Okay, so now we need to check the label on the medication carefully against the MAR to make sure that the correct medication is being prepared. So this is important because for us to prevent error of any medication administration. Again, don't forget to check the expiration date. Okay. Okay, so now organize the equipment to save time and energies. Now let's move on to the subcutaneous injection. We need to perform hand hygiene and observe other appropriate infection prevention procedure such as clean gloves. I'll be right back. Okay, so as you can see, I already put my gloves on. So now we need to provide for client privacy to provide comfort. So again, close the doors and curtains. So now we need to prepare the client. Prior to performing the procedure, introduce self and verify the client's identity using agency protocol to enhance rapport and ensure if care is being rendered to the correct patient. So good day, ma'am. My name is Isaiah Michael J. Velasquez, your nurse for today. We will be conducting a subcutaneous injection. So later I will be injecting in your upper thigh right here. So you will, I'm back, and as you can see, I already put on my gloves. Now, we will provide for client privacy to provide comfort. So, again, close the doors and the curtains. So, we need to prepare the client prior to performing the procedure. We need to introduce self and verify the client's identity using the agency protocol to enhance rapport and ensure if care is being rendered to the correct patient. So, good day, my name is Isaiah Michael J. Velasquez, your student nurse for today. May I see your wristband, please? Thank you so much. Please state your name and age, your birthday, please. Thank you so much. So now, we need to assist the client to a position in which the arm, legs, or abdomen can be relaxed depending on the site used to provide comfort. So ma'am, are you comfortable in this position? Okay, thank you so much. So, obtain assistance in holding an uncooperative client. So, since my patient is cooperative, we won't be needing further assistance. Now, we need to explain the purpose of the medication and how it will help using language that the client can understand, includes relevant information about the effects of the medication to gain the patient's cooperation. So, maayong butag ma'am. So, mag-inject po dito sa imuhang taas sa imuhang tay ma'am ha. So, ay kabala ka maran siya paak sa lamo. So, di kay try sad nako nga dinidjud ka masakitan ha. So, effects ani ma'am. So, basig magsuka-suka ka ma'am or basig ka nang malipong ka pero if mahitabo man na ma'am kay tawagan ako ma'am ha kay nara ko sa station o para matabangan ka na ko. So now we need to select a clean site. So this is to select site that is free of tenderness, hardening, swelling, scarring, itching, burning, or localized inflammation. So we need to select a site that has not been used frequently, as irritation, inflammation, and discomfort can be avoided. So we need to apply clean gloves to maintain sterility, just like this one, as I said, I did it earlier. So as agency protocol indicates, we need to clean the site with an antiseptic swab, start at the center of the site, and clean it, widening circle about 5 centimeters to 2 inches, so to allow the area to dry thoroughly. So, okay ma'am. So ma'am, i-clean na ko ni din ma'am ha. And throw the bin. Now, to place and hold the swab between the third and fourth fingers at the non-dominant hand, or position the swab on the client's skin above the intended site. Friction aids in the cleaning of the skin and removes dirt in an away direction. So again, at the third and fourth finger, right here, at my non-dominant hand, since it is my left hand. So we need to prepare the syringe for injection. So this is the syringe that we will be using. Remove the needle cap while waiting for the antiseptic to dry. Pull the cap straight off, avoid contaminating the needle by the outside edge of the cap to avoid contamination. Okay. We throw this later on with the needle. Now we need to inject the medication. So we need to grasp the needle in your dominant hand, my right hand, by holding it between your thumb and fingers. So just like this. So with the palm facing to the side of upward for a 45 angle insertion, or with the palm downward for a 90 angle direction. So this is to prepare to inject by using the non-dominant hand, pinch the skin or spread at the side and insert the needle using the dominant hand, and a firm steady push. Pinching helps to pull the fatty tissues away from the muscle and makes the injection easier. So now, so i-insert na ako ma'am. Okay. So when the needle is inserted, move your non-dominant hand to the end of the plunger. Some nurses find it easier to move the non-dominant hand to the barrel at the syringe, and the dominant hand at the end of the syringe. Okay, just like here. Oops. So it is that fell off right off. I'll be using another one. Okay. So now, inject the medication by holding the syringe steady and depressing the plunger with a slow and even pressure for support and easier injection of solution. So, injecting now. So, remove the needle. If bleeding occurs, apply pressure to the site with a dry, sterile gauze until it stops. So, we will be, when withdrawing this, withdraw with the same angle as we inserted it. Okay, now we need to apply pressure. So next, we need to dispose of supplies appropriately to protect the nurses and others from injury or contamination. For that, I'm placing this here, and then we'll crack the needle to prevent injury and dispose. Now, we need to assist the patient into a comfortable position. Flip down the medication ticket if not using MAR. So ma'am, are you comfortable in this position? Okay, thank you. So now we need to do aftercare. Remove the gloves, dispose the used items in appropriate waste receptacle to return other equipment to its proper place, especially the MAR machine. So now we need to perform hand hygiene to deter the spread of microorganisms and to prevent contamination. So I'll go back. Okay, so now we need to assess the effectiveness of the medication at the time it is expected to act. And now we need to document all relevant information to prevent medication error and promote data abuse for the future. So, thank you for watching. That is all.